You have 12 pairs of cranial nerves. These are nerves that go straight from the brain to the effector. They do not pass through the spine. Each nerve has a name and a Roman numeral. So we're going to go through the 12 pairs of nerves and see what they do. And I'm not going through every detail of every function of each nerve. I'm just giving you the highlights of what these nerves do. So the first one is number 1, which is the olfactory. So I have little clues here to go with it. So I have an olfactory to help you remember the name olfactory. And there is some perfume here. You smell perfume. So the olfactory nerve carries your sense of smell. And that is CN1. That's why it has a Roman numeral 1. Cranial nerve number 2 is the optic. And if you know that old police song, I'll Be Watching You, you can think of that for the optic nerve. This nerve is what carries vision. Next we have oculomotor. So think of root words. If you break this down, oculo, remember when we were talking about muscles? And you have the orbicularis oculus. So this refers to eye, and then motor is going to have something to do with movement. So one of the things this nerve does is it moves your eyes. And you use extrinsic muscles to move your eyes. So extrinsic muscles are the muscles on the outside of your eyeball. Okay, in my clue here, I have annoyed pupils. So that's a little pun. Think of pupils as students and pupils also as those little holes in your eyes where light enters. So this muscle or this nerve controls the size of your pupils because it will stimulate your iris. Your iris is the muscle that controls the size of your pupil, and it will stimulate your iris to constrict your pupil. Okay, then they roll their eyes, that's the movement, and then stare off into space. That has to do with your lens. Your lens is the part of your eye that focuses. So when you're looking up close and reading, or when you're looking far away, you have to change your lens. And that is the ciliary muscle that makes your lens focus. So the oculomotor does those 3 things. Then next we have the trochlear nerve. This one will also cause eye movement. So it's going to stimulate your extrinsic muscles. To cause eye movement. Okay, then the 5th one is trigeminal. And I know this is kind of tricky because you think a tri, it should be 3, but it's not. It's number 5. So that's why I have a 5-year-old boy, so you can remember it's number 5. Okay, he chewed his gum. So this nerve stimulates the masseter muscle, which is what makes you chew. The gum was warm and soft. So that's general sensory from your tongue. Remember that you have taste and you also have temperature and texture of your food. So this, the gum was warm and soft, tells us that it is carrying general sensory from the tongue, which is the temperature and texture of your food. Okay, then he blew a bubble and he felt it on his face. So it also does general sensory of your face and head. So that's going to be like touch and temperature of anything that's on your face or your head. Then we can move to abducens, which is number 6. So I have here 6-pack abs. So you can think of number 6 and it's abducens. It starts with an AB. And this one is also eye movement. And see how her eyes are looking to the side? That's called abducting your eyes. Think of chapter 9, like when you lift your arm out to your side, that was abduction of your arm. If you make your eyes move to the side, that's abduction of your eyes. So this one is also going to be extrinsic muscles to move the eyes. Okay, then number 7 is facial. So I have 7 dwarfs, so you can think of the number 7. And the first part's pretty simple. It's the facial nerve, and it is responsible for your facial expressions. Think about how much you can tell by looking at somebody's face and the expressions they make. That's your facial nerve that does that. Also, it says the 7 dwarfs make faces while crying and spitting about food. Well, when you cry, you have tears. So this nerve stimulates the lacrimal glands. These are glands above your eyes, and they make tears. So it's not just when you're crying, you always need tears in order to keep your eyes clean. And then spitting. So this is going to stimulate the submandibular and sublingual salivary glands. And they will make saliva. And then the reason they're crying and spitting about food is taste. So your sense of taste comes through the facial nerve, and it is taste from the anterior part of your tongue. So we have a different nerve coming up that's going to carry taste from the posterior part of the tongue. Then we can move on to number 8 is vestibulocochlear. So this one comes from your ear, and it comes from 2 different parts of your ear. That's what it's named for. The vestibule of your ear has your sense of balance. Which is also sometimes referred to as equilibrium. And then the cochlea of your ear is the part where your hearing is. So this nerve comes from your ear, connects your ear to your brain, and it has your balance in your hearing. Number 9 is glossopharyngeal. So he uses spit to make his food glossy. So this stimulates the parotid salivary gland. Makes saliva. Makes his food glossy so he can taste it. So this is taste from the posterior part of the tongue. It is also general sensory for the tongue. So this is another one telling you the temperature and texture of your food. And then this nerve is also involved in making you swallow your food. If you think of its name, glossopharyngeal, this part refers to the pharynx, which is your throat. And when you swallow food, it goes into your throat. All right, number 10 is the vagus. This is going to be the cranial nerve we talk about the most in future chapters. You're going to have a lot of stuff about the vagus. So the vagus nerve does a lot of parasympathetic activity. It is going to stimulate your heart, and it's going to cause it to slow down. So your heart beats on its own, but your brain can tell it to speed up or slow down, and your brain uses the vagus to slow down. It's going to stimulate your digestive system and tell it to work harder on digesting your food. So it stimulates the digestive system. And in your respiratory system, it's going to stimulate bronchoconstriction. So it makes your airways narrow. And it also carries sensory from all of these abdominal and thoracic organs to your brain. Okay. Number 11 is the accessory. So I have the necklaces here because necklaces are an accessory. And this little girl is shrugging her shoulders and tilting her head. So this is two muscles. It stimulates the trapezius. This is the muscle that makes you shrug your shoulders. And the sternocleidomastoid. So we've already learned these muscles. If you remember, the sternocleidomastoid is in your neck, and this is the muscle that makes you tilt your head. And like if you put your chin down on your chest, that is your sternocleidomastoid. And then the last one is hypoglossal. This nerve is what makes you move your tongue. All right, so there are your 12 cranial nerves and an overview of what they do.